Virgie Bright Ellington is a board-certified internal medicine physician. She is also a passionate patient advocate and author of the book, What Your Doctor Wants You to Know to Crush Medical Debt. She is on a mission to teach Americans medical financial literacy so they can avoid drowning in astronomical medical bills. Her journey began when she awakened from an emergency surgery and learned that her hospital roommate, of limited financial means, signed an agreement to pay a balance bill that would keep her family in debt for years.
My hospital roommate had been tricked into putting her family into debt for the rest of their lives.
To make matters worse, 6 months later, Dr. Virgie received a health summary statement of nearly $90,000.
I get a statement in the mail that says that, actually it's 3 lines. It said, your patient services, $351,000. Second line, insurance / adjustment / payments. I think it was something like $250,000 or $60,000. And then patient responsibility, basically $90,000. And then there was, again, talk about the magic wishing number in the usually in the upper right-hand corner, which is, I call it the number they want you to think you owe. They're wishing and hoping and praying you'll fall for it. And underneath that was, hey, questions about your bill, call the billing department, patient accounts department. The number was there. The first call I made was to my best friend. It was the middle of the day, weekday, and I just had to talk to someone. And so I said, you know what, I just got this statement, and I was cracking up laughing. I was laughing, and she said, Virgie, you're the only person I know who's laughing when everybody else would be curled up in a ball crying.
She could laugh because she knew she did not owe thousands of dollars, and the service provider quickly wiped out the debt. Dr. Virgie's medical training had taught her nothing about the billing side of healthcare, but as an executive at an insurance company, she learned plenty.
So there are different rates depending on who's paying. The provider will send a different bill with different amounts depending on who they believe is paying. They'll send one amount if they think they're sending it to a commercial insurance company. They'll send another amount if they don't think you have insurance, and it's what's called cash or self-pay to the patients. And there's another bill or amount if they know that the payer is Medicaid, state insurance, or Medicare, federal health insurance. So yeah, depending on who they think is paying, they'll change the numbers.
On her Voice of America radio show, she and her guests discuss health, wellness, and medical bills. As a speaker, author, TV news guest expert, radio show host, and patient advocate, Dr. Virgie's mission is already changing lives and saving families from financial ruin.